Please join me in welcoming Mamta Valderrama. Mamta is a healthcare strategist turned social justice author and speaker. She trained as a journalist at USC. In January, Mamta published A Girl in Traffic. It's a story based on true events about organ trafficking in India, but it is a novel. She's going to tell us about this multi-billion-dollar health crisis in organ trafficking and her efforts to inspire action by educating and also actually entertaining readers, which is important. So thank you, Mamta.
Thank you, Bindu. Imagine that you earn $1 a day working as a farmer in a remote village in India. You're uneducated and you have a family to feed. Then somebody offers you $5,000 for one of your 2 kidneys. They tell you the procedure is safe and that they'll take care of you during your recovery. So you agree, because it's the best offer that you've ever received, and it's a one-way ticket out of poverty for you and your family. After the procedure, you wake up on a filthy operating table in an even filthier room. You're lying on your stomach, and as you try to sit up, a shooting pain from your abdomen stretches down through your legs, rendering you completely paralyzed. You're moved to a nearby room, filled with dozens of other people whose pain could rival yours, and suddenly you realize you're in a human chop shop. You're assigned to a dingy mat on the floor. A man who calls himself doctor comes to see you once a day but prescribes nothing. They feed you once, maybe twice a day. After a few days, they shove you into a van and dump you on the side of a dirt road and tell you that your home is somewhere that way. And that $5,000, they chuck a few hundred at you and tell you they had to deduct your recovery expenses. As they drive away, you sink to the ground, suddenly realizing that you'll likely die right there on the side of that road and never see your family again. And in your heart of hearts, you know that they've already turned around and sold your kidney for hundreds of thousands of dollars to some wealthy Westerner. Now imagine that you're an American. Your son, your daughter, your husband, your wife has been on dialysis for 5 years. They've been called in for a transplant twice, but both times the donor backed out at the last minute. Dialysis is grueling and it's time-consuming, and the survival likelihood of your loved one is decreasing year over year. What would you do? Would you consider going abroad? Many people think that organ trafficking is a Hollywood myth. 10,000 organs are trafficked every single year, and those are just the documented cases. This is a multi-billion-dollar global health issue, and it's the topic of my book, A Girl in Traffick. It's an emotional, harrowing thriller about a family that falls apart after they've been trafficked. I first came to know about organ trafficking about 10 years ago in graduate school. I was writing a business plan on medical tourism, and I came across story after story about organs that were being trafficked out of India. I wasn't just horrified as a person. This was actually very personal because my own ethnic background comes from there. I've traveled all over India, including remote villages. Maybe they had been preyed upon in the past. After I graduated, I ended up working at a large dialysis provider, and I became even more immersed in the American kidney system. I started knocking on doors of senior executives, asking them to pay attention to this issue. But the harder that I knocked, the more rejections I received. And I realized that as I was pointing at these executives, asking them to care, I had one finger pointing at them and 3 more pointing back at me. I was uniquely qualified to write about this issue, so I quit my corporate job and I spent 3 years writing A Girl in Traffic. Now you might be sitting here thinking, this is clearly very tragic, this is horrifying, but how is it relevant to me? Well, when I give this talk to healthcare executives such as yourself, I tell you 3 reasons why you should care. The first is my own personal interest. I want to dispel the myth and raise awareness about this issue. I hope I've done that today. The second reason is that I suspect that as the population in our country continues to age and healthcare access continues to shift, more and more Americans will consider going abroad for medical access. They may not go all the way to India, but certainly to nearby countries, and so many of them are already doing that. In the case of transplants, it's a simple issue of supply and demand. There are 100,000 Americans waiting for a kidney transplant. Only 25% of them will actually receive one this year. And kidney failure in this country is growing by 5% every year. The third reason is that if you work in diabetes, cardiovascular medicine, fitness and exercise, high blood pressure, and many other clinical areas, the work that you're doing directly impacts kidney care in this country. Look, I'm just an independent author. My goal is to end this inhumane practice. But you all are the healthcare technology experts with access to some of the best minds in science and medicine. After this session concludes, I'll be at my booth in the exhibit hall, and I'm raffling a few copies of my book. But more importantly, I want to engage in a dialogue with all of you. I want to start a conversation about how we can approach this problem together, whether that is curing kidney disease itself, partnering with the team over here up the street at UCSF designing artificial kidneys, if it's improvements in the way that we deliver dialysis, or something we haven't thought of yet. I want to end this inhumane practice, and I'd like your help to do it. Thank you very much.
Thank you, Mamta. So tell us a little bit more about the partnership and the collaboration with the work at UCSF. You hinted at that a little bit.
So there is a team of engineers up the street at UCSF headed by an engineer named Shuvo Roy. They are designing the world's first bio-kidney. It's a fully artificial kidney. It's going through a lot of testing and trials right now, as you can imagine, but the outcomes so far have been very positive, and they're looking to bring it to market potentially within the next 5 years.
That's really exciting, and that's just one glimmer of hope, and the advocacy of people like you, and hopefully other ways of vetting the sourcing of where these organs come from that will hopefully reduce this horrible epidemic. So thank you so much for joining us today.
Thank you.
Okay, thank you.